And we are now live.
All right, good morning. This is the Senate Health and Welfare Committee meeting of March 21st. And we're at a place where we have ended crossover, and now we're getting ready to go forward and look at other issues. So this morning I thought it would be helpful to look at, we have 3 bills on our agenda that are time sensitive. And so we'll talk about those first, and they're on the agenda for the week. I have them listed for you. There might be others that we look at. H411 is the COVID flexibilities bill that's come to us from the House. That has to be on the governor's desk for signature by March 31st. It gives us very little time to hear testimony and then act on it. But just to let you know that the group of folks who have been following this along for the past couple of years during COVID have sent in notes supporting the bill. So we'll hear from them, representatives of the healthcare folks. I've also heard from the Green Mountain Care Board and others about their interest in having the bill go forward as it currently exists. My ask of us is to read through the bill briefly. For some of us, at least for Senator Hardy and myself, it's deja vu all over again. But then there are some really important pieces in there to help our healthcare world stay together post-COVID. So that bill. Then the other bills that we'll need to look at, and then we'll walk through briefly on Wednesday, are S89, and that's about establishing a forensic facility, and S91. S91 is truly important to us in here. It's very much a part of our jurisdiction. And so I'm going to be working to have that bill available to us even after it's passed out of judiciary. So after it's passed out of judiciary, if we brought it in here, it would essentially, at this point, it would end the bill's life this session. So we will either be able to have it come in here with forgiveness and then be allowed to send it out, or we will be allowed to look at the bill as it sits on the calendar over the next several days, however that goes. So that's a bill that is talks about insanity as a defense and competency to stand trial. It is a bill, it is an issue that we've been working on with the Supreme Court Chief Justice's group to look at this. They're very interested in that. Judiciary's interested. We're very interested in it. And it does fall in our jurisdiction. So I'm talking a little longer about that bill because it's so critically important. So we'll look at that. Those 2 bills will appear on our agenda, not just that one day, but continuing forward. And we may see them Thursday as well as Friday. But then you'll notice that our agenda will also be ending tomorrow just before 11 o'clock and Thursday just before 11 o'clock is on the floor. So what you have in front of you you still have the bills that are there, but the time will be different. Just an update. That's that. There's another bill, S73, which is coming out of economic development, which is about firefighters and cancer, and we may look at that one as well, as much as it relates to us. Then, good. So, Alex, can you put up for us the list of bills that we have in committee that are currently in committee? We've got them up on our bulletin board, but it would be great for us to look at them together and just scan through some of those bills. Can we do that?
Of course, one moment.
And we're getting a lot of House bills over. In particular, we're going to see some compact bills, which we will be acting on. How many? We don't have a lot of House bills in here. H411.
All right, I am sharing now. Is that coming through for you guys?
Yeah, we can see it. Why don't we scroll? Let's look at the H bills that we have.
The H bills are right at the top here.
So the rateable reduction for Reach Up, that's a bill that we will probably look at. And then H190, we will definitely pick up to look at. That's been an issue very much in the news. And then H411. So those three bills will begin with. I think H190 will probably be not picking up until at least next week. And we'll have reporters of the bill come in on those. You already have Jessica Brunstead scheduled, Alex?
For 411,
H94.
I believe that I do have the reporter scheduled for that. I don't think that it's Jessica, but
Yeah, okay. And I see you have Representative Houghton scheduled for tomorrow.
yes,
Our
we'll be meeting at 8 a.m. tomorrow, Madam Chair, with 411.
Okay, that's fine. I'm sorry, committee. We'll do that because of the 11 o'clock start time. We'll start at 8. Okay, that's good for now. We'll come back and we'll look through some of the S bills at another time. We also have a significant number of reports that we'll want to look at in conjunction with some of the House bills that we're going to be able to pass out. We may be able to add some information there, so that'll be good. Okay, well, that's good. You can take the screen down.
So are we discussing things more broadly, or?
I think for now, let's just wait until we see whether we get other bills in. And we'll look. I know that there are a lot of things that we would like to do. And a lot of those things are embedded in some of the Senate bills that we have. So as we go forward and we see House bills coming in, we may want to add in some elements of our Senate bills. So we'll move on.
Okay, I just want to say on the record that I really would like to hear from that report about the eating disorders.
Okay,
And see if
yes.
there's a vehicle we can find for any legislative action on that.
I'm with you on that.
Okay.
That the eating disorder report is an important one. And there are other important other reports. And so I'd suggest if we each look at the reports that are on our webpage or that we're getting, there may be some recommendations we can pick up and use for an amendment into some of the bills that we have. It's really hard when reports come in January and we're already moving along. So, okay. Oh, and the other bill that we're going to be getting very soon is H222, which is the opioid settlement bill. And that was coming over from the House. So that will go up on our agenda pretty quickly because it will influence the budget. Okay. So anything else? So reports, in particular, the eating disorder report that you're interested in, Senator, we can certainly look at that. Are there other reports or issues that you want to bring up at this point? Yes, sir.
I don't want to derail, but I am curious of the next step. As a bill reporter, you talked about the House member coming over, who's the reporter there, coming in here to testify. How does that process work for us? Are we expected to go to that committee and say a few words?
You'll be invited. Most committees chairs will invite reporters to come in and share a little bit about the bill, not the whole full report, but just to introduce it to the committee. So you may be invited in depending on which committee it is. And so similarly, once S25 is finished or the child care bill is finished, then you'll be invited into the House to present the,
Okay, thank you.
and they expect 5-10 max minutes. It's not a lot, yeah. Good question. Okay, and in the case of, well, that's good. Okay, so the other thing that we had talked about doing was to draft a letter to the federal delegation. And I know that we've already heard from people who are interested in Medicare Advantage plans. I'm just going to make a list. I have a letter here, and I'll just read off the topics that are in the letter that I started in March 2021. There it is. And then COVID really has gotten in the way of life. So Medicaid reimbursement is one. During COVID, our FMAP was increased by 6.2%, and that has allowed for a variety of providers to remain whole. And so in my letter, I asked them to increase Medicaid to at 105% of Medicare rates. So if I think we'll leave, unless I hear differently, I'll go through all of these and then you guys can all add on or subtract. So Medicaid reimbursement continues to be an issue because it does provide for a cliff where you see people getting private reimbursement, you see Medicare reimbursement, and then Medicaid. And so the compensation that comes from our private insurers, so we think it covers the Medicaid lower reimbursement, but it doesn't always. So that's a question we may want to ask our delegation to look at to improve reimbursement rates so that they're at least Medicare equal. But we can put this into
Do we have a draft of your letter?
I just found it.
Okay,
and
it's hard to talk about a letter that we haven't seen or
No, I'm
taken
not talking
testimony
about, I'm
on.
just all I'm gonna do is lay topics out. I'm not
Okay.
talking about any specific language. If you don't like the topics, that's what I wanna know. If you'd like to add topics, we can do that. And then I'll have Jen, bring in a new draft. Medicare and prescription drug pricing. Now, since this letter was written, the Medicare drug pricing has been changed at the federal level. So I don't know. This was really more about a variety of issues in Medicare drug pricing. So we'll just hold that thought. Prescription drug pricing generally, workforce, improving funding for our workforce, whether it's for tuition payments, job incentives, tax credits. So that might be something we want to continue to think about. And telehealth and telemedicine, which obviously has changed since 2021, but the equipment that's needed, the support for IT, for software, for everything. So there may be something we want to say in the letter regarding telehealth and telemedicine. One of the areas that we mentioned when the delegation was in here was our inability to affect any self-insured. So the ERISA plans or ESI. And so we know that a state like Hawaii has a capacity to do that regulation, and their healthcare system is significantly more robust than what we are what we have. So, so some language around if Vermont, or how can Vermont be allowed to regulate self-insured plans so that we ensure, remember, that's the biggest piece of the pie of the people. And so we have this little tiny piece of the pie that we can regulate, and everybody is after us to reduce costs and increase access when some of the costs are out in that big chunk that we don't even have control over. So that's something we may want to think about. So I'll just, those are the things that were in 2021. Those are some of the things in the letter. So they were Medicaid reimbursement, Medicare and prescription drug pricing, the workforce, and telehealth and telemedicine. There might be some others. So that's just that's a beginning list. The question I have is for you is regarding the Medicare Advantage plan issue, because we need to firm up what we know about that, and then what it means in this state and what it means potentially at the federal level. Because what's happening, the implications are that the Medicare services that are currently being offered for senior citizens now are being handed over to private organizations, and they have a different set of rules from Medicare. They're not completely the same as Medicare, so that what can happen is that those rules change midstream. That's an issue. So maybe we need to think about that a little bit.
We're getting a lot of,
We're getting a
not
lot.
so much now, but the beginning of the session, we got here,
Well, what we're getting the emails on is about the state retirees and the governor attempting to impose a Medicare Advantage
and
plan on them.
I don't understand that, so. I
So-
really
so,
can't
yeah,
talk
so
about it, so.
The biggest issue around the Medicare Advantage plan, switching someone over to it is, once you're in the Medicare Advantage plan, you can't go back to Medicare. You're done. That's it. And so if you're currently getting treated in a network and for specific disorders or diseases, there's no guarantee that that's going to continue. It makes it really difficult. We'll get someone in to talk about that for two reasons. One, we may want to think about how or if we want to weigh in on what's going on with the current retiree question, the SEA type question. And the second one is, what can we recommend to our congressional delegation going forward? So, and that's really more about rules at the federal level than it is about specific statute, but we'll have to look at that. Yeah, go ahead, Ruth.
I'm fine with talking about a letter, but I think that it will have pretty minimal impact. So I'd rather spend our time talking about our bills and doing some of these bills. I have a bill on primary care spend, and I would really love to talk about that. And if we are going to do a letter, I think we need to take testimony on the issues, and given our limited amount of time, it may be better to focus on the laws that we can pass.
I think we will spend time on the letter. We're not going to spend a lot of time on it. There are a lot of bills up there with very important issues, including the blueprint expansion to mental health and substance use disorder and others. There's a primary care bills up there. There are some bills that are not up there yet that will be equally important. But our congressional delegation specifically came in and asked us for what could help us. And I think if we can identify a few things they can work on, knowing where, in particular, the role that Senator Sanders currently plays in healthcare, I think it'll be valuable for us. So we'll do it. We're not going to spend a lot of time. We'll put together a letter, and then we'll refine it and we'll send it. Yes.
Okay, curiosity question. Senate bills that are on the wall.
Mhm.
Crossover was last Friday.
Mhm.
how do we keep them alive?
They stay right there, and then we get House bills.
Right, I get
So,
that.
yeah, so the priority is House bills. However, if there's something in a Senate bill that fits within the House bill, we might put an amendment on. We don't want it to be too big, because then it will,
So as an example, Senator Hardy.
Senate bills will stay there and we can pick them up in January.
Right,
Yeah,
but is the tactic to potentially pick up elements of, like, say, S-84 and move them into, into a House bill? Is that kind of the,
That's one way that you can move bills or parts of bills forward if they're germane to a bill that we
Right.
get from the House. The other thing is because the bills stay alive, we can pass a bill in the Senate now that didn't make crossover for us, but then would be up on the, House wall for next year, and they could start working on it right away. It
not
helps
quite, it's
sort
not
of
quite that
speed
simple.
things up for the second.
That's
year
why,
session.
so what I was gonna, exactly what you were saying, Senator, we can pass a Senate bill out. If we do it after crossover, it goes to the Rules Committee, and the Rules Committee holds it. And then if there's a plea for that bill to move to the House, then it can move to the House, and that request can come from either House, or it comes from us because it's the Senate Rules Committee, but usually it's the chairs of committees talk together and say, yeah, this is important, let's get it up, let's get it out right away. So that can happen, but we don't usually pick out things that are in bills to put in House bills, but it is really possible, it is very possible that there are some things that are up there. And then there are some issues up there that might make their way into the appropriations, into the big bill. So, for example, the pilot program for Blueprint on mental health and substance use, so that may end up. So there are different things that can happen, but basically our focus over the next several weeks will be on House bills. And if we get fewer House bills, we have more time to act on a Senate bill and get it going. So, yes,
good, okay, thank you,
Yeah.
thank you both.
yeah, that's good. Okay, so my question of you is, are there other issues that you would like to take up for, let's start first with the letter. And then I know we got lots of bills up there.
My issues with the federal delegation are not related to health and welfare.
Oh, we're not taking them up. Okay,
Right.
it depends.
So, but I'll think about it over the next 24 hours if there's something.
Yeah, that would be good. Okay,
Thank you.
I'll get my letter to you. I'll maybe make a couple changes to it, so it's still timely, but, yeah, and I've already taken stuff out because times have changed. Okay, what I'm gonna suggest, and then go through the bills up there. Some of those bills are, for example, the bill, I have a bill that I've been working on, and it's in there, it's up there, that has equity of reimbursement, including increased reimbursement for primary care. And that regulatory work is actually happening right now in Green Mountain Care Board. So do we need to pass a bill that does that if it's already happening at the regulatory level? Those kinds of questions are things we need to ask. And then last year, we put increased reimbursement rates for our designated agencies. And this year, we see that there is a that long-term care facilities continue to be in dire straits. So the question is, are there recommendations that we can make to the budget, to the appropriation committee? So we'll try to get a handle on each one of those things. And we'll pick bills off the wall, look at the bills that are up there and that you would like to have a quick run through or an understanding about with Ledge Council, and we can do that. I do not guarantee that we will do Senate bills right away. But at least we'll try to get an understanding of what's there. Okay, yeah. Yeah, there's still a lot to do. Right. And we've just seen the tip of the iceberg with regard to mental health and substance use disorder in the bills that we've worked on that are coming to us from judiciary and that are coming to us from the House on substance use disorder. Okay, I'm going to give us Alex. I think we're going to go off live. We're just going to wrap today. We'll come back to discussion when everybody has a list of bills or ideas that they'd like to look at.